Hello, everybody. Today I'm gonna talk. I'm here to do my unit 1664 journal. So talking about a period of time when my experience in mental health, or when I have cared for a patient with mental health problems. So I will talk about my past experience having my clinical rotation while I was doing my degree program in mental health. During that period, we did our clinical rotation, which lasted for about 8 weeks in a mental health facility. There, we had to look after patients with diverse mental health problems. I saw patients with depression, patients with anxiety, patients with suicide. Some patients tried to harm themselves. Some of them jumped from the fence, like they wanted to go home. Patients that wanted to kill people. So I've had like mental health experience in the graduate level. Okay, talking about recently during the work experience, at sometimes we have, though I work in a medical floor, I have had patients with psychiatric problems being admitted for medical purpose. So such patient, for example, patient with suicidal attempts. So I've had one in recent times whereby the patient was on safety one-to-one, where we had somebody like is monitoring and observing patients and preventing this patient from harming him or herself. I know that those kind of patients, during my experience with them, they feel like kind of judgmental. Also, so many times we have psychotic patients, but they need medical help. These patients, we got to give them some medications to keep them away from hallucinating or killing themselves, like quetiapine, Seroquel, things like that. So that's my experience so far in mental health. Also, last time we did a rotation on psychotherapy, whereby I was opportune to engage in psychotherapy sessions for people with depression, people with anxiety, people with difficult family dynamics, people with PTSD, a lot of mental health problems. So to an extent, I would say that I've had a couple of mental health experience. So I chose to work with this group of people because they feel unserved, or they feel stigmatized. Originally, when someone has a mental health problems, or when someone is taking a mental health medications, people are looking at the patient like, oh, so imagine the patient has mental problems. So I feel like they're stigmatized. That's the reason why I decide to like pursue my career in psychiatry in this population, because I feel like they are not being looked after. So I want to help them. I want to speak for them. I want to advocate for them. I want to make sure they are receiving the best possible care. And also for the geriatry and for the elderly population, I feel like sometimes these people are mismanaged. Like some patients that are having some medical problems are being misinterpreted as having some mental problems. Talking about people with dementia, I've worked in the medical care of the elderly ward, where people with dementia are being treated like people with mental health problems. These two things are two different things. As people are aging, the cognitive functions are declining. So this is one thing we have to have at the back of our mind whenever we're treating this patient. Are these signs and symptoms, are there real psychotic signs, or are there like dementia signs? So this is the reason why I've gone into psychiatry, and also caring for the elderly population, to make sure that they are not being stigmatized, to make sure they are being served the way they should be served. So talking about my concern for this course, like I said, this course basically is like for diagnosis of adult population. The adult population, like I said, especially the geriatric, my concern is misinterpretation of signs and symptoms, ability to not to differentiate medical problems, especially cognitive medical problems, from mental health problems. So I think this is one of the things I will be looking out for, especially people with dementia, people like that. Again, my concern is ability to treat mental health problems in elderly people with their existing coexisting problems, coexisting medical problems, because there are some drugs that will not go with some other medication, with some other health problems. So this will be my concern in this course: my ability to integrate all these things together, my ability to make sure that patient is given safe care, my ability to make sure that the assessment for this patient is safe at all times. So this is my major concern for this course. So talking about my academic goal for this course, so at the end of this course, I'm expecting that I should be tending toward expert for psychiatric medications in the use of psychiatric medication in the geriatry, like the use of medications in adults. I should be able to, like, to an extent, have mastery on medication use in the elderly people, especially the labs that is being monitored, the dosage, all those things. So that's one of my goals. Another goal I have is that at the end of this course, I should be tailoring having good assessment and diagnosis of patients. I should be able to figure out the diagnosis for this patient whenever they present in my clinic. I also look forward having good confidence and good collaborations between myself and other members of the healthcare teams. So another of my personal goal is to improve in my confidence, especially in assessment, diagnosis, and management of patients, especially elderly patients who has presented in my clinic. Finally, I would love to have a good time in this course. Actually, I would want to. One of my goals is to be able to balance my work as well as my school with my looking after my kids. Thank you so much. Thank you.